Now we will be discussing the respiratory system. So our respiratory system is divided into different regions. You have an upper respiratory tract and a lower respiratory tract. The upper respiratory tract starts from the structures, no, from the nose to the larynx. So this portion here is your upper respiratory tract. Beyond the larynx, okay, from the trachea through the alveoli in the lungs is the less lower respiratory tract region. So let's identify the particular structures of your respiratory tract and its description. We'll start with the external nose. Your external nose encloses the chamber for air inspiration. Okay, air inspiration can be through the nose and the mouth. Okay, so that's the main function of the external nose. Then you have the nasal cavity that cleans, warms, and humidifies the air inspired. So that is being filtered by the hair inside your nose and the mucoid entrapment of foreign bodies such as dust is also a means for cleaning the air before it goes to the lower respiratory tract. There is also warming. That's why you have various directions where the air flows not through the nose, and that actually is filled with all of blood vessels too, and this could warm the air first before it reaches the lower respiratory tract. And it also serves as the humidifying chamber, no? And then the pharynx, which is called the throat, this would serve as the common passageway, okay, for food and air. So at the level of the pharynx, dyan pa dumadaan both ang food and air. Okay, now the larynx is the one that we call the voice box. This is a rigid structure that helps keeps the airway constantly open or padded. Okay, so here at the larynx portion, after your pharynx, the larynx only permits, normally, would permit air. Okay, so kung may foreign body dyan, aside from air, for example, food or object talaga, then that is already an aspiration. Napunta yung object to a wrong opening. Okay. Then the trachea, this is called as your windpipe. This is served. This serves as an air cleaning tube to funnel inspired air to each lung. And the bronchi, these are the main tubes that direct the air into the lung. So if you just imagine you have a trachea first, and then it divides into a right and left bronchi. Okay. Then the lungs, which is a labyrinth of air tubes and complex network of air sacs called alveoli. This is the functional unit of the lung where gas exchange occurs, okay? And capillaries. So this is the site of gas exchange between the air and the blood. Okay, so let's discuss the different aspects of respiration. So you have two, no? You have ventilation. This refers to the movement of air, no? So remember, when you say ventilation, it refers to the air, okay? Coming in and out of the lungs. And then your respiration would be the diffusion of gases across the plasma membrane. Okay, when the gas now starts to diffuse, that's your respiration. Okay, sometimes we also call this the um, perfusion. Okay. Now, there are two types of respiration. There is what you call a pulmonary respiration and a systemic respiration. Pulmonary respiration is also known as external respiration. This is the movement of gases between the atmospheric air, no, in the lungs and then into the blood. What's the difference between your pulmonary respiration to your systemic respiration, also known as your internal respiration? This refers, no, yung systemic respiration, sabi dito, movement of gases between the blood and the body's cell. Okay? So, most likely, nauuna talaga si pulmonary, no? Respiration. That's why it's external. It gets the air first in the environment, and then it diffuses into the blood, no? I mean, the gas diffuses into the blood. Once the blood is already in the, no, once the gases are already in the blood, which is actually your oxygen, then the blood delivers it to every cell of the body, no? And that's what you call systemic respiration. So the process of gas exchange is actually simultaneous, no? So it's happening at once, okay? But we will discuss each process so you would know what's happening during the gas exchange. Let's have the ventilation first. We know that ventilation is the getting of air, no, coming from the gas coming from the atmospheric air into the lungs. So this is more commonly referred to as breathing. Okay, ventilation, breathing is similar. This, as I discussed, is the movement of air into and out of the respiratory passages. Now, the pulmonary respiration, okay, we also touched this one. This is the movement of the oxygen, uh, out of the alveolar air and then diffusing into the blood. So you remember your alveoli or gas exchange occurs. There are capillaries surrounding each alveoli, no? And the alveoli has a very thin epithelium, no? And that is your simple squamous epithelium. So very thin siya, so that very simple layer so that the air can diffuse easily, no need for energy. So this is a non-energy requiring process. So the air diffuses from an alveoli to the nearby capillary. So that's your pulmonary respiration, no? Going to the gases from the alveoli diffusing to the blood. At the same time, in exchange for the oxygen from the alveoli, no, you will also get the carbon dioxide. So this is coming from the blood. You take it out from the blood, and then it also diffuses, the carbon dioxide also diffuses to back to the alveoli. Okay, so once it is in the alveoli, it can be exhaled. Okay, that's the purpose why you have an exchange for oxygen with carbon dioxide. So the carbon dioxide diffuses out of the blood and joins the air in the alveoli. So that's your pulmonary respiration. And then the gas transport, okay, your carbon dioxide and O2 travel in the blood. Okay, so imagine your capillaries, your blood vessels, they are all supplying every cell of the body. And our cell needs oxygen for the metabolic processes to happen. So as the blood passes by through these cells, they supply, no, they give off the oxygen, which is coming from the lungs. They give off the oxygen to the cells, and then in exchange, the cells during their metabolic processes, meron din silang waste product. This is your carbon dioxide. So in exchange for an oxygen being supplied, you take away the waste product, which is the carbon dioxide, back to the blood. No? So parang exchange lang siya. And then when the blood circulates back to the lungs, the carbon dioxide diffuses again, no? from the blood going to the alveoli, and then in exchange, kukuha din siya ng oxygen. And then it will transport again the oxygen to all the cells of the body, and so on and so forth. Okay? That's the gas, how gas is being transported. And then you have a systemic respiration. The gas exchange with the tissues involves exit of oxygen from the blood into the cells, while carbon dioxide exits cells to enter the blood. Okay, so this is what I actually described earlier. Okay, that's your systemic respiration. Now, let's go to the different functions of the respiratory system. First is the regulation of blood pH. Okay, so remember there are two organs that are responsible in regulating very carefully the blood pH. One of them is the respiratory system, but the other one is your urinary system. So you will also hear the same function, no, when we discuss the urinary system. So how does your respiratory system helps in regulating the blood pH? Okay, so it regulates the blood pH by the amount of carbon dioxide in the blood. Okay, if there's too much carbon dioxide in the blood, our blood becomes acidotic. Okay. So, anong gagawin ni respiratory system kung ang daming oxygen? Acidotic si blood. Anong gagawin niya? Then you would need to breathe fast so you can exhale more and more carbon dioxide. Yun yung kanyang response. Now, if the pH is too high naman, which is alkaline, that's also dangerous. So, anong gagawin ni respiratory system? The respiratory system would try to conserve carbon dioxide to contribute, no, to decrease the pH, no, into the normal level. So, yung patient na to, minsan lang hihinga in order to conserve carbon dioxide. That's how the respiratory system regulates the blood pH. Ang mechanism ng urinary system is also different, okay? We will discuss that when we go there, okay? In the particular topic for the urinary system. Second function, production of chemical mediators. So what are these chemical mediators? No? One of the most important chemical mediators that is being produced in our lungs is an enzyme called the angiotensin converting enzyme. Okay, this angiotensin converting enzyme, you also call that ACE. The presence of this enzyme is actually makes your blood pressure high, no? So, kung masyadong mataas yung ACE content, this will contribute to a high blood pressure. So, it is necessary, it would be helpful if you are actually trying to treat a patient with low blood pressure. However, if you actually are familiar with the different kinds of medicines to lower hypertension, no? One of them is what you call your ACE inhibitors, no? That's your angiotensin converting enzyme inhibitors. Example ng mga drugs na ito are your captopril, no? If you've heard of this, no, enalapril, these are all ACE inhibitors. That's why they are antihypertensive, because they block, no, the function or the action of this particular enzyme ACE. So, blood pressure is prevented to get higher. That's why they are ACE inhibitors. Yun yung mechanism of action ng mga drug na ACE inhibitors. Now we know that the voice box, no? This is the main function of it, voice production. So we will discuss more when we discuss the larynx later. Then olfaction, no? The smelling, the sense of smelling. and protection, which prevents entry of pathogen to the body and removing them from the respiratory surfaces. How is this? So our tract, the respiratory tract, meron yan siyang specific, no? Very particular lining epithelium covering the tract, entire respiratory tract. And what is this lining epithelium? This is what you call your pseudostratified columnar ciliated epithelium. Okay, remember cilia. Okay, so yung lining epithelium mo, merong konting mga, actually, meron siyang hair-like projections. And they move to one direction, no? Papalabas, papalabas. So in case there is a foreign body, for example, dust, in an environment where you inhale air with so much dust, no? These dust, no, very fine particles are being trapped by your mucus. No, because we have constant production of the mucus. Our cells in the respiratory tract have this capacity, no? Particularly ang tawag sa mga cells that produce mucus are your goblet cells. So they produce mucus. Itong mucus, it can be a means to trap, no, dusts or any the impurities in the air that we breathe. So once they are being trapped, your air will try to sweep it up away, no, papalabas. So that's one reflex. Okay? We also have another reflex, the cough reflex, no? Yung mga dapat hindi mo nalalanghap. You have the response of coughing. It's a protective, no? It's a protective mechanism to protect the lower respiratory tract. Okay? So yun yung means of protection natin. Okay, now let's discuss first yung upper respiratory tract. No? As you all know, these are the structures under it. The nose, the pharynx, and the larynx. Okay. Let's discuss the nose. So we know this is the external structure of the upper respiratory tract. Okay, so it has an external structure. That's your external nose. That's what you see in the face, and then inside of it is the nasal cavity. Now it has 5 functions. It serves as a passageway for air. When you inhale air through it, it cleans the air, humidifies and warms the air, and it contains the olfactory epithelium. Olfactory epithelium is the one responsible, no, for the sensation of smell, and it helps determine voice sound. So the first three, ito na-discuss ko na earlier, no? How does it clean the air, and how does it humidify, no, and warms the air as it passes through the nose. Okay, after the nose, no, ito siya, nasal cavity nyo. So you would see actually here, you have a superior concha, a middle concha, and an inferior concha. So the air has to pass all this, dadaanan niya yung passageway, no? It is designed like that so it would have time to be filtered, and it would have time to warm the air first, no? And humidify it before it goes to your lower respiratory tract. Okay, now the pharynx. After the nose would be your pharynx. So, saan yung pharynx natin? That's your nasal cavity. We're done with that here. Okay, so on this portion is the pharynx. So, this is your throat. Okay, in layman's term, pharynx is called your throat. So, this is still a common opening both for food and air. No? So, lahat dyan dadaan, no? Both ang pagkain mo and yung air-inspired. See. Now, let's have the different regions, no? Your pharynx is divided into 3. Okay. So, let's start with yung uppermost region niya, which is your nasopharynx, no? That's why naso kasi siya yung pinakamalapit sa nose. Nasal cavity. Okay, yun yung clue niya. Siya yung first. And this is the most superior portion. It is lined with a mucous membrane that traps debris, no? Such as dust and microbes or other pathogens. So ito na yung mucus production that I discussed earlier. And it is continuous with the middle ear through the auditory tube. Okay, so what is the significance, no? You have a connection between the nasopharynx and your ear. That's why sometimes, no, if you blow your nose too hard, you would actually affect your ear via this opening, no, via this connection. Okay? And sometimes, worst scenario, okay, which is really not normal, yung sipon lumalabas sa tenga, okay, which is very, very abnormal. So I don't know if you heard of those instances, pero that is the explanation behind why those things happen, okay? Now let's go to the second. Okay, the next region is your oropharynx. So that's the middle portion here. Oropharynx, oro means oral, no? Malapit sa bibig. Okay, that's why it's called oropharynx. Middle portion of the pharynx and the air, both air and food and drink pass through, no? This region of the pharynx, no? Kahit oro siya, pero yung air that you inspire from both the nose and the mouth still passes through, no? And the food from the mouth could still pass through here. Okay, common passageway sila, remember that. Then it joins the oral cavity and contains, no? Your oropharynx contains your palatine and lingual tonsils. Okay, remember this one. Baka matanong sa exam, which region of the pharynx contains the palatine and lingual tonsils? And you would know, okay, it's your oropharynx. And then the last region, no, yung pinakamababa, it's your laryngopharynx. Okay, so it's laryngo kasi it spans the posterior length of the larynx. Okay? So, meron kang clue actually, no? Sa kanilang names. Okay? From the most superior larynx structure, the epiglottis to the esophagus. Yan yung kanyang length, no? This region of the pharynx, both pa rin, food and drink, pass through the laryngopharynx to the esophagus. Now, what is difference with the rest of naso and oro? Wala na ang air. No? It's only the food and drinks that goes through this region. Okay, laryngopharynx, only food and drinks. Yung air, it will separate now, no? Dadaan na siya sa ibang pipe. Okay, now after the pharynx is the larynx. Okay, so we mentioned it's also known as your voice box. So hanapin natin dito saan si larynx, no? Okay, this portion, no? This is your laryngopharynx and saan siya pupunta? Esophagus. That is you're going to the stomach. That's why pagdating mo sa region ng laryngopharynx, ang pagkain na lang, no? Yung papuntang stomach, yun yung dumadaan dito. Okay? While the other structure, which is your larynx, okay, this is located, no, in front of your laryngopharynx. So, sa harap niya, nandyan yung larynx mo. And then extends from the base of the tongue to the trachea. Okay? So, yung trachea mo, that's your windpipe already. So, this time here, uh, hangin na lang ang dumadaan. Okay? It's only air that passes through. Kasi kung may food dyan, no, na masaag, matukan ka. Okay? We'll try to cough it out because it's not supposed to go there. Okay? So your larynx has an outer casing of 9 cartilages connected to one another by muscles and ligaments. Okay? So meron kang cartilage. Okay? It actually maintains the structure of your larynx, no? Para hindi siya mag-collapse. So now, let's discuss the different cartilages of the larynx. So your larynx can have a single cartilage, no, yung walang partner. Meron ka ding paired cartilages. So first, we will discuss single cartilages of the larynx. First is your thyroid cartilage, no? It's so big. You can see it here. This one, oh. That's your thyroid cartilage. This is the largest and it's filled shape. Okay, this is also known as your Adam's apple. Thyroid cartilage mo yan, no? Yung nakaprotrude dyan sa throat, usually prominent in male. Okay, so it's called your Adam's apple. Yung cricoid cartilage naman, this one, no, cricoid cartilage just beneath your thyroid cartilage. It's a ring shape naman, and it forms the base of the larynx. Okay, so nasa ilalim lang siya ng yung thyroid cartilage. Then you have an epiglottis. Okay, this part here, parang flap, no? Kita mo ba yun? This is looking anteriorly. Then if you are posterior, no? Ito itsura niya. Okay? So, yung epiglottis mo, this is a single piece of cartilage that is attached to your thyroid cartilage, and it projects superiorly. It's a freely movable flap, no? So, it moves, and it is made up of an elastic cartilage, okay? And it diverts food away from the trachea opening during swallowing. So, anong nangyayari? When you swallow, since this is a movable flap, when you swallow food, this will close the airway. No? It will close the larynx to protect it from food and other foreign bodies. Now, when you laugh while you eat, or when you inhale accidentally while you eat, or when you cry while you eat, no? Nakahinga ka bigla kasi umiiyak ka, then this will actually open, no? When you inhale, when you breathe, this will open. So that's why it's dangerous to talk at the same time eat kasi baka ma-aspirate nyo yung food, no? Supposed to be, papunta siya sa laryngopharynx, no? Then to the esophagus. Okay? So, yan yung function ng yung epiglottis. So, naka-side view, ganyan siya. Pag inhale, it will open. Pero pag lulunok ka, when you swallow, this flap closes and protects this portion, no? So that no food, no foreign body will enter. It's for air. Okay? Now, let's go to the paired cartilages of the larynx. Okay, you have an arytenoid cartilage, you have a corniculate cartilage, and a cuneiform cartilage. So, paired sila. Hanapin natin first si arytenoid cartilage. Okay, yung arytenoid cartilage mo would be here. Okay, ayan siya. No? It is located, no? Nakikita nyo posteriorly. So, it's ladle-shaped cartilage that articulates with the superior border, no, of your cricoid cartilage at the posterior portion. Okay? So, ayan siya. And then a corniculate cartilage is a horn-shaped cartilage, and they are attached to the superior tips of the arytenoid. So, sa taas lang ng arytenoid mo, may corniculate cartilages. And then your cuneiform cartilages, these are wedge-shaped cartilages, and they are contained in a mucous membrane that is anterior to your corniculate cartilage. So, ito. Okay, you just remember three-paired, no? Yan sila. Now, the larynx, as we know, this is your voice box. It is called like that because it houses the ligaments that is responsible for speech formation. No? Aside from that, that's also the ligaments for swallowing. Okay? So let's discuss itong mga ligaments, no, in the larynx. Yung vestibular folds nyo we are now discussing on the vocal cords. Okay? Yung meron kang true and false vocal cords. So, yung vestibular folds, sila yung false vocal cords. Okay? So, if you look at this one, ito yung ano niya itsura. But your false vocal cords are here. But the true ones, ito siya. Yung white portion. So, these are yung vestibular folds or your false vocal cords. They are a superior pair of ligaments that extend from the anterior surface of the arytenoid cartilages to the posterior surface of the thyroid cartilages. Okay? And then your true vocal cords, sila yung nasa ilalim. No? These are your inferior ligaments, and they are an opening at the junction of the vocal folds. So, yung opening na yan, this is your glottis. Okay, so you know your epiglottis siya yung gumagawa sa flap, no? And yung glottis mo is this portion here, no? Yung opening between the vocal folds. Okay, what is the function of the larynx? So it maintains an open passageway for air movements, no? Again, for air, huh? It prevents swallowed materials from entering the larynx and the lower respiratory tract. So, ano nga yung responsible, no? Movable flap that covers the larynx when you try to swallow. It is your, what is that? Epiglottis, okay? Now, it produces sound for speech. That's your voice box. Now you have the vocal folds, the true and the false vocal cords. In order to create your speech, okay? And it protects the lower respiratory tract from foreign materials. Okay, so ano yung mga clinical diseases that are very common affecting our respiratory tract, no? Particularly sa upper portion. You have your rhinitis. This is the inflammation of your nasal mucous membrane. Ang most common presentation niya would be sneezing, no? Very itchy yung nose, runny nose. Okay? This can be of two types. Merong allergic rhinitis when you inhale something that you are very irritated with, no? Which is an irritant. And you also have a non-allergic rhinitis. So, non-allergic rhinitis, they appear, presentation even without the presence of an irritant. Okay? And then another one is sinusitis, which are inflammation of your sinus mucous membrane. So, most common affected are the paranasal. Sila yung nasa, beside the nasal passages, no? That's why medyo masakit yung pisngi, yung ulo, if you have obstruction of the sinuses. Okay? So, ito yung mga most common causes. Viral infection, no? Common colds, flu, yan. Can be allergies or a nasal polyp. The other one is laryngitis, which is the inflammation of the larynx, particularly in vocal folds, no? So what is the most common presentation for this, no? Is namamaos, no? The person loses his or her voice, okay? Laryngitis is also can be caused by viral infection, same, no? Common colds, okay? That's laryngitis. Let's go deep to our respiratory system into the lower respiratory tract. Your lower respiratory tract consists of the trachea, bronchi, lungs, tracheobronchial tree, and lastly the alveoli. So we will discuss one structure each at a time. The first structure under your lower respiratory tract system is your trachea. Your trachea is also known as your windpipe. Tinawag siya na windpipe because this airway, no, will accommodate air only. Kaya siya windpipe. You remember above this is larynx, no? Both food and air passes through, no, sa mga tubes. But pagdating sa trachea, it's only air. That's why it's only windpipe. So, ganito ang itsura niya in your throat, no? Magkatabi lang si trachea and si esophagus. Your esophagus is located at the posterior portion of your trachea. So, nasa likod siya. Kapag pagkain, edible objects, no? If you swallow, a flap closes your trachea in order to protect it from aspirating, no, food or other objects. So, pupunta yan sa esophagus. Kapag air naman, no, this will go through your trachea. So, this is a membranous tube. It is reinforced with 15 to 20 C-shaped pieces of hyaline cartilage. So, yung cartilage niya, C-shape. Okay? Yung sa likod nito, wala ng cartilage. So, sa harap lang siya, no? The C-shaped cartilage is only in the anterior portion. May cartilage yan para hindi mag-collapse, no? Hindi siya ko-collapse. Okay? So, that's about 15 to 20 C-shaped pieces of hyaline cartilage, and you call this your tracheal rings. And this supports the trachea to prevent it from collapsing, as I mentioned. So, if you look here, yung cartilage mo is only till here, no? Pero hindi mo siya ma-appreciate. Hindi mo siya masyadong ma-appreciate. So, ganun ang kanyang itsura. Posteriorly is your esophagus. Okay, let's go to the next structure, which is your bronchi. The trachea further divides to form two smaller tubes, no? And these are your main bronchi. You also call this your primary bronchi, and each of which extends to the lung, no? Both sa right and sa left. So, your bronchi, your primary bronchi or your main bronchi, you have a right and a left bronchi. And yung sa tip niya, dito, is, you call it carina. This is a ridge of cartilage at the location where the trachea divides into two main bronchi. The mucous membrane of the carina, dito, is very sensitive to mechanical stimulation. So, kapag may foreign matter dyan na nalaglag, no, it is inspired to the level of carina, then you will have a very powerful cuff reflex in order to push that foreign object out. Okay? So, kwento lang ako, I have a patient before when I was still a nurse, no? He was a grade 1 student and alam nyo ano yung nalunok niya? It's pito, no? Whistle, color red na whistle. Now, upon x-ray, nasa karay na talaga. And this patient was already scheduled for a bronchoscopy, no? To manually remove the foreign object kasi nandito siya sa karay na. But the night before the operation, pag rounds ko, nilabas niya lang din. Inubo niya ng very powerful ang pito. So, just imagine a red whistle coming out from that patient, no? Grade 1 patient. Ewan ko paano niya nalunok, no? Baka nilagay sa bibig or huminga ng malalim, kaya na-inhale niya yung pito. Okay, now let's go to the lung. So, remember, yung bronchi natin, magdi-divide pa yon, no? May mga sub-branches pa siya into your bronchioles, okay? And then, yung lung nyo, you have two lungs, okay? You have one in the right and one on the left, okay? So, when you say base of the lung, this is the portion of the lungs in contact with the diaphragm. So, dito. And the apex would be the one that extends above the clavicle. Ito siya. Actually, above the clavicle, that is a very dangerous site. If kapain nyo siya, above the clavicle, you have a small depression there, no? Kapag prines nyo siya, malalim yan. And actually, that is already the apex, no? Of the lung. You can, nandyan located yung apex of the lung. So, kapag dyan ka tinamaan ng baril, nasaksak, or whatever trauma, no, that happened in that portion of your clavicle, taas niyan, then this is the portion of the lung that can be possibly injured. Okay, yung apex. And when you say hilum, this is the indentation on the medial surface of the lung where the structures such as the main bronchus, blood vessels, nerves, and lymphatic vessels enter or exit the lung. So this is your hilum, no? Nandyan yung mga main vessels and bronchus, okay? And the root of the lung refers to all the structures passing through the hilum. Okay? Okay. So let's describe more your lungs. Your right lung has 3 lobes, while yung left mo has only 2 lobes. Okay? So these are the lobes of your lung. 3, no, for the right and 2 for the left. Okay? The lobes are separated by deep fissures. So ito. Ito yung mga fissures ng iyong lung. You have a horizontal and oblique fissure, no? Siya isang fissure lang. Each lung is supplied by a lobar bronchus. Okay, so remember your bronchi divides into a right and a left. Yan yun. And there is what you call a cardiac notch, which is a medial indentation in the left lung. So remember, yung cardiac notch, nakikita siya sa left lung, which provides room for the heart to lie between. So ano yung parang cardiac notch? Parang meron siyang depression kasi ano siya na doon doon pumepesto ang heart. Okay? Towards more on the left lung. Okay? So, ang medial indentation, nakikita mo siya sa left lung, and that's what you call a cardiac notch. No? Yan yung space intended for the heart. So the lobes are further subdivided into bronchopulmonary segments, and each is supplied by the segmental bronchi. So there are 9 bronchopulmonary segments in the left and 10 in the right lung. These bronchopulmonary segments are even further subdivided into smaller segments. You call them now your lobules by a connective tissue. Okay, and the bronchioles supply each lobule. Okay, so imagine your tracheobronchial tree. It consists of the trachea, that's why tracheo, and the network of your bronchi, no? Network of air tubes in the lungs. Each right and left main bronchus, so you have a right and left main bronchus, they divide to form smaller bronchi. Ito na yung mga smaller bronchi ninyo that continue getting smaller until they terminate, no, in microscopic tubes and sacs. Okay? So, paliit ng paliit ng paliit. The right main bronchus is larger. If you look at this picture, yung right nyo is larger and more directly in line with the trachea. Okay? So, ito pala. This is left pala, no? So, tingnan nyo. Mas malaki siya compared to your left main bronchus and mas vertical siya. Itong left nyo medyo slightly horizontal. So, right main bronchus is more in line, no? Meaning mas vertical siya with the trachea. Okay? So, anong implication? Imagine if there's an object falling here, where do you think it will most probably drop to? Sa right or sa left, no? By law of gravity, it will be sa right. Kasi siya nga yung mas vertical. Okay? So that's the reason behind if you inhaled a foreign object which is not supposed to be there, napupunta siya sa right main bronchus because of this structural description. Approximately 16 generations, no, ang dami, of branching occur from the trachea to the smallest air tubes. Each class of air passageway is lined with a type of ciliated epithelium. So, yung passageway, ang kanyang lining epithelium, when you say lining epithelium, yan yung cells on the surface, no? Inner surface of the passageway. So, ang kanya is ciliated, meaning there are hair-like projections, and these hair-like projections, no, you call them cilia. Okay, that's why it's called ciliated epithelium. This function as a mucous cilia escalator. Ang ibig sabihin nito, mucous cilia escalator, para imagine an escalator. Yung escalator, for the airway, yung mga hair-like projections niya, they sweep the mucus into one direction. Okay? Palabas. Meaning, papuntang palabas. Palabas ng mouth. Palabas ng nose. Okay? So, meron siya, imagine yung hair-like projections, no? Because you constantly produce mucus, then the mucus has to be swept out, no? Out of the airway, no? Respiratory tract. That's why isang direction, which is palabas, and that's a protective mechanism actually. No, your mucociliary escalator reflex actually yan. Now, this mucus is a form of trapping debris, no, from the air and then moving it into the larynx. Okay? So, yung mucus, kapag may na-inhale ka, because the air that we inhale are not pure. Meron yung mga dust particles, Okay? And they are being trapped into our mucus. So every time yan, may mucus, which would have trapped some impurities in the air, papalabas yan ng cilia mo. No? It will sweep off, no? Escalator reflex siya, palabas. So you can spit the mucus out. Now, in smokers, ito yung nasisira sa kanila. Okay? This reflex is depressed or decreased in a smoking person kasi nasisira yung ciliated epithelium. Okay? Now, there are 4 classes of air passageways. Okay? We list this from the largest to the smallest. Okay? So, yung pinakamalaki are your lobar bronchi or secondary bronchi. That's the bronchus after your main bronchus or primary bronchus. Diba? You have a primary right and left. After they subdivide into a lobar bronchi. So each lobe, no? My bronchi, each lobe. Okay, that's why it's called lobar bronchi. So they arise directly from the main bronchi. And the left lung has 2 lobar bronchi kasi yung left lung mo has 2 lobes while your right has 3, no? 1 for each lobe kasi your right lung has 3 lobes. Each lobar bronchus supplies its own section of each lung, which are called lobes, okay? So 2 lobes for left, 3 lobes for right. The C-shaped cartilage rings. So as you remember, ito yung meron ito sa ating trachea, no? So our replay, pagdating dito sa lobar bronchi mo, yung C-shaped cartilages are replaced now with cartilage plates. And remember, no, yung lining epithelium, same, that has been discussed earlier, is still your pseudostratified. Ito mas kompleto ang pangalan niya. Pseudostratified ciliated columnar epithelium. Okay? The second one, after your lobar bronchi, they would further subdivide, no? Into what you call your segmental bronchi, and this is also known as your tertiary bronchi. They supply subdivisions within each lung lobe, which are called bronchopulmonary segments. As the bronchi become smaller, the cartilage becomes sparse and smooth muscles becomes more abundant. So dito na portion, paunti-unti na lang ang cartilage. More on smooth muscle na siya. Okay? So this bronchi is preparing na for parang transitional yung kanyang structure from air passageway only papuntang air exchange na structure. Okay? Kaya konti-konti na lang yung cartilage and now is replaced by a smooth muscle. Okay? And next are the bronchioles. Your bronchioles result from continued branching of your segmental bronchi, less cartilage, more smooth muscles, and still, no, ito pa rin yung kanilang lining epithelium. So, may hair pa dyan sa bronchiole mo, ciliated, simple columnar. If you remember, ang previously, natin is pseudostratified, no? Meaning, siya, tall cells sila. Pero ngayon dito, nagiging simple columnar epithelium na lang, no? Panipis ng panipis ang lining. Kasi this is in transition to the gas exchange structures of the lungs. Okay? So, in yung bronchioles, simple columnar epithelium that is still ciliated. Okay? Now, the terminal bronchioles arise. So, ito na yung pag mag-subdivide pa rin, no? It will give rise to the terminal bronchioles, which arise from several subdivisions of the bronchioles. So, anong nangyari? Wala ng cartilage in the walls and only smooth muscle na lang siya. And now, look, hindi na siya columnar. It's ciliated, simple, cuboidal epithelium na lang. Okay? So, panipis ng palipis ang lining epithelium ng ating bronchioles. Until yung terminal bronchioles mo until it reaches the end structure, which is your alveoli. Your alveoli, ito na siya yung area of pulmonary respiration. When you say pulmonary respiration, yan siya is the gas exchange where oxygen is absorbed and carbon dioxide is being where oxygen is being absorbed by the blood and carbon dioxide is being taken out of the blood para i-exhale niya siya. Sorry, these are small air-filled chambers where the air and the blood come in close contact. So you see, these are your bronchioles and then terminal bronchioles until you reach your alveoli. There are contact, no, between the alveoli and your blood vessels. Okay? So that's where gas exchange happens. So from the terminal bronchioles to the alveoli, there are approximately 7 generations of branching. In order from largest to smallest, no, respiratory bronchioles, they have few attached alveoli. And as the respiratory bronchioles divide to form smaller respiratory bronchioles, the number of attached alveoli increases also. Then it forms the alveolar ducts, which arise from the bronchioles, no, respiratory bronchioles, and they are long branching hallways with many open doorways that are opening into the alveoli. Okay, so ducts, parang canals lang sila. And then lastly, the alveolar sacs. These are chambers connected to 2 or more alveoli at the end of an alveolar duct. Okay? So those are your alveolar sac, no? Itong buong, this is the duct, then your alveolar sac. Okay? So let's discuss the alveoli structures. You have two types of cells that form the alveolar wall. So you have two types of alveoli in short. You have a type 1 pneumocyte and a type 2 pneumocyte. So when you say type 1 pneumocyte, sila yung nagla-line most of the alveolar surfaces, no? About 90%, yan yung lining niya, made up of type 1 pneumocytes. So ito. Yeah, type 1 pneumocytes, they line majority of your alveolar walls, and they are thin squamous epithelial cells. Most of the gas exchange between alveolar air and the blood takes place through these cells, no? Yung gas exchange happen in your type 1 pneumocytes. What are your type 2 pneumocytes? Ito siya. Your type 2 pneumocytes, they are round or cube-shaped. Okay, yan. Round or cube-shaped secretory cells. So, they secrete something kasi they are secretory cells. And what do they produce? No, surfactant. Okay? This surfactant, ang purpose niyan is to make it easier for the alveoli to expand during inspiration. No? It decreases the surface tension. Yan yung purpose ng yung surfactant. So, type 2 pneumocytes produce that. Okay? Anong ibig sabihin ng decrease ang surface tension? Imagine this is your alveoli. Kapag inhale mo, papasok si air dito. Okay? Kapag exhale, lalabas si air. Anong mangyayari dito? Magko-collapse yan. Okay? But because of the presence of surfactant, it will not totally collapse. So, every time you inhale, hindi na siya mahirapan na i-open or expand. Kasi you have decreased surface tension because of the surfactant. Now, what will happen if you don't have enough? No? Every time you inhale, expand, no? Expand, punta yung air dito. Exhale, ko-collapse yan. Okay? And you will have a very difficult time of inflating or expanding your alveoli again when you inhale. Okay, yan yung nangyayari to babies na hindi napanganak on term. When you say term, sakto sa bulan, which is 9 months. So if they are preterm or premature, they lack the surfactants because the lungs are completely formed at 37, about 35 weeks, no? 35 weeks of gestation, age of gestation. So before that, wala ka pa talagang surfactants. And your babies are at risk, no? To have a collapse of the lungs because of this um, lack of surfactants. Okay, that's all. I will also show you a video of how gas exchange happens, no? And how perfusion happens in the lung. Thank you.